Well, the important thing for any disease is to make a diagnosis. If one sees a respiratory sleep physician, they will order a sleep test, which can be had at home now or in a hospital situation. In order to manage sleep apnea and snoring, traditionally the nasal mask or CPAP is used for patients with severe sleep apnea and snoring. However, many patients cannot tolerate CPAP, so the next step is using a oral or dental device, and the older ones would bring the jaw forward and open up the airway and also create many side effects. They all function along the same principles. The aim is to open up the airway by protruding the lower jaw, bringing the lower jaw forward. Losing weight obviously is a very important aspect as well. But in summary, sleep apnea is treated by CPAP or a dental device. And in recent times, we found that increasing nasal breathing is a very important factor in the cessation of sleep apnea and snoring.